Let's move on now. I'm going to do a bit of kind of overall neighborhood review of all these structures with this 3D video like I've been doing previously. So going through this video here, we can see first off the pericardium. So we're already cutting through the fatty layer, we're cutting through the thoracic wall, we're cutting through the sternum and so on, and we get right to the heart. We can see the pericardium here nicely, the sac that the heart is found in. And I want to point out the shape of the heart. So the heart is kind of skewed to the left, such that the apex is really sitting on the left side of the diaphragm, and the base is kind of more centrally located. Right, so here we can see the base of the heart, the apex of the heart. This is a lateral view now. Here's the diaphragmatic surface. Here's the sternocostal surface. These will be the pulmonary surfaces on this side and that side respectively. Now we're looking at the posterior surface. This is the left ventricle. We can also see the right ventricle at the front here. So we've got left ventricle, right ventricle. As I mentioned before, the left atrium is kind of tucked in the back of the heart, so to speak. So here we can begin to see the left atrium. And we can see the openings for the pulmonary veins that are coming back with oxygenated blood from the lungs. We can see the 4 openings for the pulmonary veins, 2 on either side. We can also see the inferior vena cava here, and then some parts of the right atrium on this side. All right, here we can see some of the other major vessels. We've got the pulmonary artery, the pulmonary trunk, the right pulmonary artery, so left pulmonary, right pulmonary artery, which are coming off of the pulmonary trunk. We can also see parts of the arch of aorta on top here. So let's go back here just a second. So we can look down and see some of the main branches here. So this is where the arch would be coming off. Here's the left atrium, here's the right atrium, here's the right ventricle, and then the left ventricle would be at the bottom here. We can look down in here and we can see the aortic valve, some parts of the aortic valve here. We can also see the superior vena cava, looking down into the right atrium, and we can see parts of the main branches that are coming off here. So this is the right pulmonary artery and the left pulmonary artery and the pulmonary trunk. Now we can differentiate our 4 superior pulmonary veins. On the right side, we have superior and inferior. On the left side, we have superior and inferior as well. Right, so we can distinguish these 4 pulmonary veins. Okay, here we can see the arch of aorta. We can see a bit of the ascending aorta here, the arch, and then the descending aorta, which is usually called the abdominal, the thoracic, and then abdominal aorta. So this is kind of a skeletal framework of the valves. And we can see the bicuspid valve, which is the left atrioventricular valve. We can see the tricuspid valve, which is the right atrioventricular valve. We can see the aortic valve, which is leading out to the aortic arch. And then we can see the pulmonary valve here. All right, as we put these structures back together, I want to kind of point out the auricle. So we've got the right auricle here, which is the appendage of the right atrium. I also want to try to point out the anterior interventricular sulcus. So the groove that can be seen somewhat here Probably not as good as if we stripped away the pericardium, but the groove that is denoting the septum between, or the separation between the right ventricle and the left ventricle, this is called the anterior interventricular sulcus, and this is where we would find the anterior interventricular artery and the great cardiac vein. Okay. And if we kind of go back here just a little bit, we can probably see the same on the posterior side. Okay, so here we can see it a little bit better. Left ventricle, right ventricle, and then the interventricular sulcus with those two structures. And then if we flip around to the back, we can likely see under here, we would see that same posterior interventricular sulcus with the posterior interventricular artery